Good afternoon, everyone. It's a pleasure to be here. My name is Farzad Solmani. I'm the Associate Director of the Biodesign Program. And I've had the privilege of working with our Biodesign Fellows over the past 9 months. Our fellows, David Kim, Dave Morris, Jason Peterson, Sean Diamante, they all have come from very diverse backgrounds. They got together in August of last year, and they completed over 400 hours of observations, observing clinical practice and hospital operations in a variety of settings, and in all of our member institutions here at Texas Medical Center. What they realized very quickly is that nurse retention and engagement remain amazing challenges for our hospital administrators, given that all of our patients interact first and foremost with the nurses. Given that we have a shortage of nurses, we have a nursing crisis in this country, retaining and engaging and training high-quality nurses is paramount. So with that, I'm very pleased to introduce you to the Nightingale.
Good afternoon. My name is David Kim, and I'm one of the co-founders of Nightingale, a retention engine for nurses. Now, nurse retention is a tremendous problem, one that's costly and really time-consuming. We spent over 300 hours doing 500 interviews and discovered that for hospital CEOs, nurse retention is a top 5 priority. And that's because 1 out of every 6 nurses is going to quit this year, each costing $50,000 and 9 months to replace. Now that's a $15 billion problem, and one that's only continuing to grow because the US is facing a growing nurse shortage, which will reach 1 million by 2020. And that cost doesn't even include the increasing costs of poor patient satisfaction and increased medical errors that come from disengaged nurses, who are actually providing 70% of the patient-facing care in a hospital. So Nightingale is a mobile software solution that directly addresses the major causes of nurse turnover in a way that distinctly addresses the needs of nurses. The major causes of nurse turnover include poor communication among staff, a lack of recognition for good work, a lack of voice in the organization, poor scheduling flexibility, and limited compensation. Moreover, nurses are constantly on the run, time constrained, working irregular shifts, and having to deal with patient privacy concerns. So our software addresses this in 3 main ways. The first way is secure messaging and scheduling. Now this includes shift alerts. Shift alerts are public announcements of newly available shifts, extra shifts that nurses can pick up. This has proven to be a really sticky feature, driving adoption, which is used over 20 times per week by the average user. Digital reward and recognition allows a nurse to publicly recognize a nurse or a manager for the good work that they've been doing, the results of which are then broadcast by a newsfeed or leaderboard. And finally, continuous feedback. This is concise, structured feedback at the point of care, providing instantaneous feedback that enables a culture of continual coaching, which has been proven to be a lot more effective than the annual review. So we believe we are uniquely positioned in a really fragmented marketplace, and that's because of our unique focus on nurses and the unique needs of nurses, especially the nurse manager, who we've discovered to be key at improving nurse retention. Our competitors, on the other hand, are focused on generic solutions, either not focused on healthcare or not focused on the unique needs of nurses. So we employ a per employee, per month pricing plan, which lets a hospital break even on the cost of our software if Nightingale saves only 1 out of 60 nurses who will typically quit each year. That's a tremendous potential ROI and something we're really excited about. So our team brings a diverse set of skills. We have over 10 years of enterprise software development experience, backgrounds in venture capital, investment banking, at McKinsey, BlackRock, and Oppenheimer. We have a set of advisors that include many nurses from across TMC and serial healthcare entrepreneurs. And we've been applying our technologies and testing it against over 100 users and executives, components live within the Texas Medical Center and hospitals here, and are preparing for a second hospital pilot as we speak. We're currently applying to accelerators, looking for seed funding, and looking for additional nurse partners. We are Nightingale, a retention engine for nurses. Thank you so much.